All right, moving on. So we're doing another plastic surgery topic today. 2, that's a lot. Do we always do 2? I guess sometimes we do. This one's kind of along the similar lines, but of course this is something I found because of a new study that came out. And this one is a topic about the complications from tummy tucks.
Okay.
And the reason I pulled this up was because there's a new study from, there's one big journal for plastic surgery called the Plastic and Reconstructive Surgery Journal. It's called PRS. And they have a new article that's coming out in the episode? No, not episode. What's the magazine?
Edition?
Edition.
Okay.
No, is it? I don't know. The next magazine that's coming out in January is talking about this article, and I pulled the article. Travis, throw that up there so if people want to look this up. And I mean, this is kind of a very verbose way of saying that they looked at 9,000 tummy tucks over a 16-year period, but they broke these tummy tucks down into 2 groups to see how the outcomes of tummy tucks were changing in the kind of earlier days versus the more recent days. And I find this super interesting because I do a ton of tummy tucks. That's one of the most popular surgeries I do. I usually average probably 1 per week, and I don't do 1 every week, but some weeks I'll do 2. And I've done that for years and years. I mean, I know I've done over 500 tummy tucks, which that's a pretty big number. So anyway, this study had 9,000 patients in it. So it had 2 groups. The early group was from 2005 to 2014, and the recent group was 2015 to 2021. And the groups were roughly equal. It was roughly 4,500 patients per group. And what they looked at is they looked at these different factors to see, 1, what are the data on the outcomes of tummy tucks, and 2, how do they compare from the earlier group to the more recent group. So first off, the first thing they did was complication rate. So complication rate for these patients was a lot higher than I anticipated, and I'm going to talk about that at the end. But the early group had a complication rate of 22%. I thought that was super high.
Yeah, I mean, I sent one of my friends to you that had a complication.
With me? Mm-hmm. She had a complication with me?
No.
Oh, she had a complication. I could fix it or something? Mm-hmm. Oh, okay, yeah. Yeah, I thought
you were like, what? Blasphemy.
I thought you were like throwing me under the bus. Like, yeah, I sent you a patient and you bossed her.
No.
So the early group had 22% complication rate. That's super high. The more recent group had 19%, which I guess is good because it's showing that there's been a slight decrease in complication rate. But wow, those numbers were really high. The other thing they looked at is how many patients needed revision surgery. These numbers blew me away too. In the early group, 10%. 1 out of 10 patients needed a repeat surgery. Whoa, that's pretty crazy.
Yeah.
The recent group was 8%, which I still thought was pretty high. Another thing they looked at, which I'm going to talk about at the end because it has to do with tummy tucks, is how many patients got liposuction of the area where they were doing the tummy tuck, which I do very, very commonly. I would say in my patient group, I do it about 50% of the time at least. In these patients, the early group 18%, the more recent group 25%. So these patients were not getting liposuction nearly as much as I do, which came to the question of, okay, are these patients skinny or heavier, right? I mean, that makes a difference. Like if their patients are skinnier, they don't need lipo. So the average BMI, so the body mass index of these patients in the early group was 27, and in the recent group 28. Now, for those who don't know what BMI is, I mean, you guys have all heard of BMI, right? Okay, so when I throw these numbers out there, a lot of people don't know what they mean. To kind of recap, like less than 20 is kind of underweight, 20 to 25 is ideal, 25 to 30 is slightly overweight, over 30 is considered obese, over 35 is like morbidly obese, right? And just to kind of give you an idea of what a BMI of 27, that'd be equivalent to a girl that's 5'4" and weighs about 155 pounds, roughly. Okay, just to give you an idea, which is a very normal person. I mean, to me, that's like, normal.
Yeah.
I mean, it's not fit, but it's not,
yeah,
big either. So these patients in this study were actually, at least compared to what I operate on, were a little bit thinner. I would say my average BMI is probably closer to 30. And I'll talk about why that is in a minute. It also looked at how many patients were getting drains, which I'm going to talk about why that's important. Early group, 93%, which is almost all of them. Recent group, 89%. So there's a slight trend towards not using drains. And then the other thing that was really surprising to me is how many of these patients also got liposuction of their flank area at the same time. These numbers were super high to me. In the early group, 50%, in the recent group, 55%. And I'll explain what that means and why that's important.
Yeah.
But a lot of these numbers really surprised me. It did make me feel really good about myself as a surgeon because I feel like my numbers were a little bit better than this.
Yeah, seems like it.
Yeah. And also, so what were the complications? Okay, so this is 9,000 patients having tummy tucks, and it listed out all the complications they had. And these really confused me because what they're seeing as complications, like I never see. So the number one complication that they saw was seroma. Now, I know I've talked about seromas in the past. Not everybody knows what that is. A seroma is just a word for a fluid collection inside your body. And when you're talking about tummy tucks, these pop up in the area where you do the dissection. You know, a tummy tuck, you dissect and you pull the skin down to tighten it.
Yes.
We talked about tummy tucks, right? Yeah, okay. So a seroma is when you get fluid in that area where you've done that dissection. So the rate of seroma in these patients was 7%. Like, to me, that's insanely high. I know for a fact in the 14 years that I've been doing plastic surgery, I've only had one seroma.
Yeah, is that like
a
a doctor error or is that like a patient thing?
I think that probably it's related to two things. There were a fair number of patients here who didn't get drain tubes.
Okay.
That's why I put drain tubes in. You put a drain tube in, it eliminates the risk of seroma because the drain tube pulls the fluid out. And the way I do it is I leave the drain in until there's no fluid coming out, but the amount's really, really low.
I mean, my dog had to have a drain tube.
You told me your dog had a drain tube.
Yeah, I'm like, and it was just to remove fat, literally.
Well, yeah, it's a very similar concept. So I think the reason the seroma rate was high with this group is there was a fair number of patients that didn't have drains at all, and they're also their time frame where they pulled out drains was slightly quicker than what I would do. So I think I'm a little bit more conservative in when I pull them out. So yeah, seroma number one, infection was number two. That blows my mind. Infection rate of 4%. Like, that's crazy. I can only really remember one of my tummy tucks getting an infection. Like, I don't know why these numbers are so high. I mean, nowadays in infection rates, I quote people a rate of less than 1%, which I found to be true. I mean, I just don't see infection.
You take your medicine when you're supposed to and you're not like a dirty person.
Yeah, I mean, I don't know why that the infection rate was so high. Like, that really confused me.
Yeah.
Skin necrosis, meaning death of skin,
Yeah.
that was 3%. That's
strange.
to me tiny. Well, so, and I'm going to talk about what I think the biggest risks are. It is along the lines of skin necrosis, but that's kind of a high number for necrosis. But I don't know like what that means. If that meant just like a tiny bit of like scabbing is necrosis, or they meant like real full-on necrosis. Other issues: belly button necrosis 1%, asymmetry 1%, contour irregularities 1%, and then other 5%. And I'm really curious what other means because it's like, okay,
That's
what is that?
That's 5%.
Yeah, well,
big.
I assume it's like a conglomerate of everything else, right? So talking about these complications, I want to discuss these because, I mean, I guess, you know, I really am a specialist in this. I fellowship trained in cosmetic body surgery. I do a ton of tummy tucks. I just don't publish. Like, that's not my thing, is to like write articles. But, you know, I do consider myself an expert in these. Like, to me, the number one risk of tummy tuck far and away is healing issues along the incision. And they do mention that in the study. They talked about how the rate of healing issues goes up as the BMI goes up, which is totally true. I mean, 100% true. And a lot of plastic surgeons won't do tummy tucks on people who...
Doesn't that go for any type of surgical procedure?
Right, but a lot of plastic surgeons are really conservative. I mean, a lot of plastic surgeons will say, look, if your BMI is 30, I'm not going to do it.
Oh.
I'm more along the lines of like 35.
Okay.
You know, but the thing is when I get patients who come in who are a bit heavier, I really, really do kind of talk to them about the fact that their risk of healing issues is higher.
Yeah.
Now, the thing is with healing issues is that if someone gets a healing issue, like, it's usually not a big deal. Like, you treat the spot where they have a healing issue with just some like dressings, and then it heals up and they still have a great result. And so having done lots of tummy tucks and doing plenty on girls who are considered a little bit heavier, I have seen, you know, a fair number of healing issues, but I've never had a patient be unhappy.
Yeah.
Because you tell them, you know, hey, this may happen, and then if it does, like, okay, well, you told me this might happen, and then you get them through it fine, and that's it.
Yeah,
I mean,
it sounds like maybe the biggest contributor to that is just not having a doctor that communicates or that you feel comfortable communicating with.
Yeah, I think that any good outcome of plastic surgery, or really any surgery, definitely hinges on good doctor-patient relationship and talking to them.
I feel like if you're not comfortable like saying, hey, I feel like something's wrong, if you're not comfortable saying that to your doctor, then it's like, of course it's
you
going
have
to
to
get
have good
worse.
communication.
Yeah.
I agree. So yeah, for me, when I consult my patients, like, to me, like, the biggest thing that that I think they're going to see is healing issues. If a patient's like fit like yourself, I mean, we do get patients like of your body frame because pregnancy can cause loose skin or diastasis, which is stretching of the abdominal wall. That's why tummy tucks are so popular, is because pregnancy does things to your body that you can't fix on your own, just like the breast sagging, right? And so when we get patients like yourself, I say, look, healing issues are your biggest risk, but you're at really, really low risk for it.
Okay.
You know, and I'm also very careful. I don't really operate on smokers or diabetics. Those people are really, really prone to healing issues. Another thing to be brought up is the fact that the patients in this population were kind of lower BMI. Like 27 is pretty low for a tummy tuck patient, at least on average, in my opinion. I'm willing to do them on the higher patients, but you do have to understand that the risks are a little bit higher. The other thing that I think is very interesting about this is how many patients got liposuction of the sides or the flanks at the same time. I used to do that, and I quit doing it because I found that those patients were much more prone to healing issues. And there was a study that came out in 2010 that said that it doesn't make a difference, and I think that study's total crap. It was in PRS. I read the study. I thought it was junk. A lot of people kind of base their kind of way they do surgery on that study, and I just totally disagree with it. I think that if you liposuction around where you're doing the tummy tuck, like, you're much more prone to have problems. And so I make my patients break it up.
Too much.
Yeah, right. We've always talked about on the show, don't do too much at once. You absolutely can run into problems. And even this study mentioned that the more surgeries you add on top of each other, the complication rate goes up. So I really just insist that patients don't do that at the same time.
But what about whenever you do like a mommy makeover, which includes
So we do breasts, yeah.
Breasts.
So I think breasts are fine. You can do breasts and tummy, and we do that literally all the time because the breasts are far enough away that working on them doesn't affect blood flow to your abdomen.
Yeah.
But like when you lipo right around where you're doing it, that does affect it.
Yeah, that
and
makes
the risks
sense.
do come up. So yeah, I mean, this was kind of interesting to kind of see how things have changed, and to me, the complication rate in this study is just not acceptable. I mean, 20% complication rate, that's like insane. I mean, 10% reoperation rate. The one thing I would tell you is there are surgeons that do tons of these surgeries, and there's surgeons that do them every once in a while. And I kind of think that this is one of those situations where you're better off finding somebody who does these all the time.
Yeah.
I mean, I think most people who do tons of tummy tucks would say that their complication rate is not 20%. Like, that's high.
Yeah.
I do think these are great operations, but yeah, I think it's definitely important that you find somebody that can really communicate with, to give you all the lowdown on the risk, talk you through it, and that you feel comfortable that they're going to do a good job for you.
Yeah.
So, but interesting study.
My sister, because one of my sisters, the one that was taking Ozempic, or she still is, and she's always like, whenever I'm done losing all my weight, I'm gonna do a mommy makeover.
Yeah.
I'm like, okay, you gotta find some of this board certified.
Right, right? You can
like
tell
all this
them.
stuff.
Really
I was
good.
like, don't go. I was like, tell me who you're going to.
Excellent. Yeah. Well, tell me, I can look them up.
I know. That's what I told her
Yeah.
too. She lives in Austin, so I was
That's right.
like,
I know people down there too.
yeah, I figured you did. I was like, just tell me a list of doctors that you're interested in.
Right.
I'll tell you all about them.